Our culture is obsessed with social media and various aspects of emotional and mental well being. Indeed, we might criticize social media for working against our general well being and vice versa, but I am here to present you with ways that we can make social media work for our benefit. My name is Karenina Zaballa, and I'm a graduate student in Big Data Analytics, and I am part of the International Crowdfight COVID-19 team in SDSU Center for Human Dynamics in the Mobile Age or HDMA lab. Our research is centered on Twitter analysis, specifically the gathering, sentiment analysis, and visualization of Twitter data. My international team consists of volunteer researchers from Italy, Spain, Malta, New York, San Diego, London, Taiwan, Philippines, Ohio, Korea, and Australia. It's been a year since we started, and we still continue to meet weekly on Zoom to develop more research to publish our work. So how did this research begin? If you may recall, when the pandemic began, Italy's COVID-19 cases and deaths alarmed the world, making them a benchmark for coronavirus management and containment, as well as social response and recovery. Like much of the world, their healthcare system was bombarded by the disease, by the infected. But there are a few unique aspects to Italy. First, 20% of their population is 70 years and above. So that means not only were lives lost, there's a whole culture at risk and the traditions that they carry. We can also surmise that not a lot of the elderly are adept with technology. So any news relayed through applications and new technology would leave them behind. Next, Italy was unequipped to respond to such a massive health threat. That's why upon seeing the death toll rise, Prime Minister Giuseppe Conte ordered closures of all schools, major events, and sporting events due to COVID-19 on March 4th. In addition, the military was sent to help people stay in their homes, causing massive anxiety to all Italians. Last was a lack of communications of ordinances and bans, compounded by political and bureaucratic differences. This left people feeling more anxious and worried. So here's the form that people used during COVID-19, that they had to fill out whenever they left the house. Additional tracking devices are drones, sensors, video cameras, and mobile apps. And if they failed to justify them leaving the house other than for non-essential trips, their fines could range from 400 to 3,000 euros, and jail time could last up to 6 months. And then here I show how much has changed since Italy is also known for its tourism and how now it's almost like a ghost town. And then here is their Johns Hopkins University equivalent of the COVID-19 dashboard. Here it shows how the world responded to Italy's plight. A lot of different countries have chosen to help. And last is the amazing resilience of the Italian people. They show their solidarity by showing their flags, hanging their flags up on their balconies and providing outdoor concerts. Now, what are the tools that we've created? We've had three. And one is the sentiment analysis, of which we have different versions depending on the publication that we submit to. Second is our Track It COVID-19 International Screening Survey, for which you can be a part of, and which will be provided in the link in this PowerPoint. And the Smart Dashboard for Italy, which is real-time updates and metrics on our Twitter data. Now, who are we making these for? We're making these for government leaders, healthcare workers, students and academics, commercial sectors, and decision makers in general. And so with that, I will start with the sentiment analysis methodology. And we collected tweets from January 2020 until the present time. But for our demo, we're only focusing on March 2020 to June 2020, because this was the first definitive peak of the pandemic. Also, I'm only focusing on 3 cities out of the 10 that we've collected data for, which is Milan from the north, Rome from the center, and Palermo from the south. We used geotagged tweets to make sure that these tweets originated from the cities we intended. Next, we used DeepL software to translate our tweets from Italian to English. And there were a bunch of other languages, but we've mainly focused on the Italians. And then we used Emolex as our emotional lexicon to extract emotions of fear, anger, and joy for our sentiment analysis. An emotional lexicon is like a dictionary for emotions. So each word is attached or linked to more one or more emotions. And so number 4, we juxtapose these emotions in conjunction with the COVID-19 cases and deaths and the socio-political events happening around when the tweets were posted. And from there, we record our observations. All right, so here's our first graph. And this is the fear, recording of fear in Milan during this time. And then to understand this, we have to first dissect the graph. The red line is supposed to be the emotion of fear. The light blue rectangles are the COVID positive cases, and then the dark line on the bottom are the deaths. So as you can see, there's a couple of peaks in Milan right as phase 1 was enforced, probably due to the military presence in the area, as well as after phase 2. And as you can see, there's also certain phases, right? So let me define these phases. Phase 0 is from here to the lockdown phase. And here, we are looking at the first COVID-19 case up to the lockdown phase. The lockdown phase then is marked by closures and suspension of all public gatherings, including schools and religious services. All right, and then we did the same for Rome and Palermo, and then we did the same for the other emotions, which is anger and joy, and put them all together in one graph. And as you can see, the phases are defined here, as I've said before. And then as you can see, you can see where the general peaks and valleys are. We did the same for anger here, and there's a lot of anger after the second week of May, maybe due to the Black Lives Matter protests in this area, in the first week of May. And then we did the same for the joy emotion. And as you can see, there's general rises in phase 1 and general rises after phase 2 has been implemented. All right. So now I take you to the COVID-19 screening survey, for which I've mentioned before. You could be a part of this. And in this, we discuss the general themes that this survey follows. So 1 is the population, which is general demographics, age, gender, and education. And then public health and well-being, exploring the emotions of people during the pandemic. Policy, exploring the attitudes of people towards the local government and how coronavirus is managed. And technology and data, which is the social media that they used during the pandemic. And then let's show you the dashboard. The smart dashboard for Italy provides us a window into public discourse. So we collected the tweets and we provided a general metrics and dashboards for the tweets that we've collected. And so with that, I would like to end with these are the 3 tools that we can make social media work for us. What we can't see can't be improved on, but by making these results seen, we can now measure how to build the world again. It's time to empower ourselves to make social media work for our well-being. Thank you.